switching on. And then we go to our presentation, and today we have okay. So today we are going to discuss some issues connected with instructions and procedures, which we started to discuss at the previous class. And yes, well, and the first, I would like to congratulate you with congratulations on getting the certificate for online course English for healthcare. So we finished 4 weeks of this online course and we've done it. I mean, this is those students who were curious how the certificate looks like. Just you've seen that this is like one of the pages of the certificate of achievement for this course, and I think we are all proud that you have done this, and you've done all the tasks, and so I think you got something new from this course, and so congratulations. And the next thing I would like you to focus on is the results of the test, midterm 1 test, and we are going to speak about this a little. Tell me, please, are you happy with your score? I mean, the score for midterm control. Who is not happy? Is everyone happy? Can you answer me? Do you hear me?
Yes, ma'am.
So, are you happy with the final grade that you've got for midterm?
Yes, ma'am.
Yes, ma'am.
I'm happy with the final grades, but that control test that you have given for 30 minutes, it was, I didn't do well. I think I got something 23.
Yes, so you've seen your final score, and it's not, yes, I can agree that it's not, the results are not excellent, because some of the students just got only half of the score, 50%. So I was also very sad about this. Now, I would like to focus on some questions that you had in the test, just to clear out why it was so hard for us. So one of the questions here, so you remember that most of the questions were multiple choice questions, and one of them is here. Here is the definition for just definition, and we have the names of the jobs, the people involved in working in medicine in hospitals. And so the definition says about an important link between hospitals, general practitioners and other health professionals involved in antenatal care. So of course, so we can say that manager, nurse are involved in hospitals, just in working in hospitals, and other health professionals. But here the key phrase is antenatal care. This is the care that is given to the woman and the babies just before the babies are born, right? So this is antenatal, and this is the key phrase which shows us that it should be who. What's the name of the job here? Is it a receptionist as it's given here? No, because it's
no, ma'am.
So antenatal care, this is midwife.
Midwife, ma'am.
Wife, yes.
Yes, ma'am. Midwife.
We just were speaking about this during our classes, and I focused your attention on this keyword, and that is why I was surprised that so we've got such a short memory. So if we move to the next slide, here we have another question, and that is the sentence which we also discussed in our class. The question here is the sentence correct? Doctors in urban areas are usually more educated than in rural areas. What's wrong with this sentence? Is it grammatically?
No, ma'am, not grammatically, ma'am.
It will be
Doctor
done.
have the same degree, same education, ma'am.
I mean, we should pay attention to the grammar of the sentence.
It should be done. THAN.
It should be then, not then, but then. That is why the sentence is wrong, yes? So there is a grammar mistake here. It should be then, not then. And people with a good eyesight just should understand this mistake, should see the mistake. And that is why the sentence is false. So if we move to the next slide. So we should complete the sentence. A practice is run by what kind of
practitioners?
General practitioner.
Look, a general practitioner is given here, and it says that this variant is wrong. I mean that to run something is, for example, to run business. I mean to supervise something.
Manager.
So if it is to supervise, what should we just?
Practice manager.
Practice manager, yes. So here, practice manager is the correct version. So in the next one, somebody needs very good interpersonal skills because they are the first contact people have with the practice. So if you
Receptionist.
Receptionist, this is not just the midwife here. So and some grammar issues. I mean that there were given some sentences and we had to differentiate between the present perfect and past simple, most of them tenses. So in this sentence, first the history from Mrs. Simons, and then I blah 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 her. So I mean that here we have the succession of actions. If we describe succession of actions, we should use past simple. So which? A, B, C, D? Which one? So the student, both of them should be past simple. Both. This is B, right?
B. Both.
First I took the history, then I examined her. This is the correct sentence, grammatically correct. Well, and so one action comes after another. The next one, he's not available at the moment. The case notes to make sure they are up to date. So the action is happening at the moment of speaking. So there is
checking. He's checking the case.
He's checking. This is C. This is present. The present continuous tense. We should use it here. He's checking.
Yes.
Yeah. So the next is my children with the GP practitioner last year, but I with them longer. So we have the time phrase in the first part of the sentence last year. It shows that we should use the past simple. And if we speak about the second part of the sentence, longer, I think it doesn't say the exact time. And this is like just an experience, maybe I say that it's been to me for a longer period of time, and it should be present perfect. So where do we have this kind of combination? Under the letter D. So my children registered with the GP practice last year, and but I have been registered with them longer. Here we have the passive voice. So I mean, I haven't done it myself. It has been done with me. So it was done with me. I have been registered. So we need this form in the sentence. So the next one is I'm my last class for the day. I'm going home now. So we there is the information about the result that we have by now. So if we are speaking about the result, that something has finished, so we should use the present perfect tense. So we should say, yes, I have taught parente. I have taught my last class for the day. So
Yes,
I
I have taught.
Yes, I have nothing to do. Because taught can be used if, for example, we had I taught my class just at 8 o'clock. I finished my class at 8 o'clock. Even now, if we speak, I have finished. So by 8. Or yes. So here we don't have the exact time. That is why we can't use the past simple tense. Well, and yes. Do you have any other questions about the questions in the test? Do you remember anything that was not clear that you were doubt about? If you do remember, you may write to me, or you may just write this in the in the chat, in the group chat, and we can discuss this. Okay? If you do remember this.
Yes, ma'am.
Mm-hmm. Great. Now we are going to. Adris is coming. Mm-hmm. We are going to discuss instructions and procedures. And so when we speak about instructions, so we should keep in mind several rules. So in giving instructions, the imperative form of the verb can be used for giving very clear and direct instructions. Here, the imperative does not sound impolite, as each command forms a step which is part of an accepted procedure that is learned like a formula. So the person receiving the instruction will perhaps pass on the steps to someone else as part of their teaching. So the person who knows these steps, just, for example, teaches another person, gives information to another person what to do in short sentences, phrases, formed with the help of the imperative mood, imperative form. So, we use infinitives in these phrases, like complete the drug charts. This is the imperative, you should do this. And infinitive is used in imperative mood. It means without particle to complete the drug charts. If it is a negative form, we use do, or so do not or don't forget to complete the drug charts. And we can also use adverbs in such phrases, in instructions, like always complete the drug charts. So all these phrases are very short, but they are not impolite if we don't just add any polite forms, because these phrases can be used in giving instructions. And so we can also use the present simple and you for describing steps in the procedure. You wash your hands, then put on gloves. It's also possible. Or also adverbs with the present simple and you clean the area thoroughly. Or negative, you don't need to put the instruments away yet. So you is also possible in giving instructions. And yes, so I would like you to focus on this picture and try to give instructions for this procedure. What kind of procedure is it? What do
Injection.
What kind of injection?
IM.
Injection.
Intramuscular.
Yes, intramuscular injection. And so who can just say, just share what you do remember about this procedure? Teach us how to do this. What is the first phrase here, or the first sentence?
Washing hands, ma'am.
Wash
Preparing
your
the
hands.
instruments, ma'am.
Okay, then
Load the
And
injection.
gathering
Put
all
on
the
the
supplies,
gloves.
ma'am. Then locating the injection site.
And then asking the patient
And ma'am,
to turn around and make himself comfortable and sanitizing that place with some cotton or some.
exactly.
clean the injection site, ma'am.
First locating the injection site, then cleaning the injection site, ma'am.
Yes,
After
ma'am.
Then, ma'am,
After
these
injecting,
three
disposing the
preparation.
I'm asking for patient's consent.
Oh,
Prepare the
okay.
syringe with medication.
Well, for this is very just a simple procedure. I don't think that we should ask patient consent for this.
Yes, ma'am.
Anyway, so it's very important not to forget about this. Okay. Well, and here is if we move to the next slide here, we can see one of the just possible answers, just one of the possible instructions. So about wash your hands, gather all needed supplies. We also mentioned this, locate injection site, clean or sterilize injection site, prepare syringe with medication, inject the medication with a syringe and remove the needle. So just you see that these phrases are very useful in just in teaching, for example, a nurse how to do this procedure well. So the imperative can be used when just doctors are talking to each other or nurses, and they just teach other person how to do this well. And now we are going to read an article which is called DOPS, Direct Observation of Procedural Skills. So, and there is some information in this article about the functions of Royal College of Physicians. So RCP, this is the abbreviation for this college. Now, let us just first look at the phrases and the words which are given here. So the text that we are going to read, it describes the practical DOPS, direct observation of procedural skills. on which trainee doctors in the United Kingdom are assessed. So, here on this slide, we can see some verbs, and we should choose the noun which you think will follow the verb in the text. So you do remember that this is about assessment of some practical skills of doctors. And so in the first line, number 1, Arun Chalam, what do you think?
Feedback, food information data, ma'am.
Yes, provide feedback.
Yes, ma'am. Provide the feedback, information data, food information data.
So I mean, there we have 4 nouns: feedback, food, information, data. So so which noun do you choose?
Feedback only, ma'am. Provide the feedback.
I see. Okay. Then let us listen to Madhumita.
Undertake searches, procedure surveys, undertake surveys, ma'am.
Researchers. Mhm. So if we look, don't forget about the title of the text, direct observation of procedural skills. So undertake, other versions,
Searches, investigations, procedures, ma'am.
procedures, of course, undertake procedures. Let us listen to Divya, please. Number 3. Divya, are you here? No, minus Divya is absent. Well, so Priya.
Yes, ma'am. Access the competence, ma'am.
Assess competence. Exactly, yes, competence, some kind of knowledge. Mhm. Okay, then let us listen to Rajkumar. Are you here, Rajkumar?
Yes, ma'am.
Number 4, please.
Identify patients, ma'am.
Identify patients or any other possible phrases. Who can think of any other phrase?
Places.
Okay.
Places.
Mhm. Okay, so
Identify strength,
strength.
strength.
Just it's the possible. It's a lot of phrases. Okay, Badris, please, number 5. This is for you. Badris?
Administer medications, ma'am.
Okay, great, thank you. Then let us listen to Prerna. Prerna,
Yes, ma'am.
6.
6 is seek help.
Seek help. Okay, and the last one is is for Nishat.
Yes, ma'am. Consider feelings, ma'am.
Consider feelings.
Yes.
Nishat. Okay, let us check. So here's the slide with the phrases from the text, which we should understand. And if we'll just move to the next. This is the beginning of the text, and so we are going to read about trainees. Trainees, a person undergoing training for a particular job or profession now. And encounter here in this context, this is a meeting, some kind of session. Well, and let us listen to Prakriti. Will you please read the first part of this article? Prakriti, are you here?
Yes, ma'am. Yes, ma'am.
Please.
DOPS is designed to provide the feedback on the procedural skill essential to the provision of the good clinical care.
Read the whole paragraph.
Okay, ma'am. Trainees will be asked to the undertake 4 to 6 observe encounter, or procedure during the year with a different observer for each encounter. Full stop. The assessor include among other experienced specialists, appropriate nursing staff, or consultants in a secondary care setting. Full stop. The estimate time taken by each procedure is 20 minutes. And that is 50 minutes for the assignment and 5 minutes for the feedback.
Mhm. Do you understand what you are reading? Is everything clear? Are there
Yes, ma'am.
any words that we don't understand? The other students, do you have any questions about the meaning of the words that I hear? Is everything clear?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Procedure.
Yes, ma'am.
Okay, so let's move on, and here there is another portion of another paragraph, and now let us listen to Samhita.
Each
Samhita?
top should represent, yes, ma'am. Each top should represent a different procedure, and trainees should choose from each of the core problem groups identified in F2 curriculum by the end of the year. The trainee chooses the timing, procedure, and observer.
Mhm. So here we have the F2 curriculum. This is foundation 2 curriculum. This is for the second year people who study medicine. So the second year foundation 2. Okay, and for the next slide, we should listen to Rafael.
Yes, ma'am. It is essential that all trainees should be adequately assessed for competence in the practical procedure that they undertake. Directly observed procedural skills is a method that has been designed specifically for the assessment of practical skills and was originally developed and evaluated by the RCP. In keeping with the foundation program quality improvement assessment model, strengths and areas for development should be identified following each job's encounter.
Mhm. So, do we remember this abbreviation, the RCP? So,
Respiratory care practitioner.
no, this is the name of the college.
Royal College of Physicians.
Royal
ma'am.
College of
Royal College
Practitioners.
of Physicians.
Physicians, yes.
Physicians,
Yes,
ma'am.
ma'am.
Okay.
Physicians.
Mhm. Well, what about the other words? Are they clear? Do you understand what is what
Yes, ma'am.
paragraph is about? Okay. Mhm. Okay, and now please, Ayman, this is for you.
Yes, ma'am. Ma'am, DOPS includes a range of procedures. For example, venepuncture, vein puncture for cannulation, the use of local anesthetics, arterial puncture in an adult, blood culture peripheral, and blood culture central. Also include an nasogastric tube insertion and airway care, including simple adjuncts and intubations.
Mhm. There are a lot of medical terms here. Do we understand them?
What is simple adjuncts?
Simple. Mhm. Mhm. So I don't know how to explain this. Maybe you can just have a look. Somebody can help us and have a look at the translation, because it's better to translate. And who can find and maybe definition for this? So can anyone find this phrase?
And helps in increasing the ventilation of patient, ma'am. The airway patency.
So, I mean, do you understand now?
Ma'am, I couldn't hear him.
So will you repeat one more time, please?
Yes, ma'am. These simple airways are these airway adjuncts are increasing the success rate of basic airway, ma'am. That is
Okay, okay.
to maintain the airway patency.
Can you
Yes, while
translate?
intubation. Yes, ma'am. I understood.
So, and this is IV cannulation. So this is not just a number, this is IV.
Yes, ma'am. IV. It's intravenous.
Mhm. Okay.
Hmm.
Well, thank you. Now let's move to the next part, and now it's just Arun Chalan, it's your turn now.
Yes, ma'am. Each doctor needs to satisfy a number of criteria, some of which are given below. Apart from overall ability to perform a particular procedure, the trainee needs to demonstrate an understanding of relevant anatomy and the technique of the procedure. There needs to be clear demonstration of appropriate preparation before the procedure takes place, as well as knowledge of the appropriate analgesia or safe sedation and aseptic technique.
Mhm. Okay, so what about this part? Do we understand everything here? Are there any difficult words that we can't understand? So do we understand everything?
Yes, ma'am.
Okay.
Yes, ma'am.
And I think this is the last part. Now, please, Madhumita.
Apart from the technical ability, a trainee needs to seek help where appropriate and demonstrate post-procedure management as well as good communication skills, while at the same time considering the feelings of the patient.
Mhm. I think here this is so it's clear. This part is clear. Okay, so this is about the this kind of assessment, and let us move to the next slide where we have to discuss something. We have to discuss we have to choose one of the phrases from each sentence. But I see that our time, yes, we have about 1 minute. That is why let us just take a break. Let's take a break, and in 10 minutes we should join our conference, right? See you in 10 minutes.